good day. So today we will be discussing a vector-borne disease which is schistosomiasis. So we will start with an icebreaker named Guess the Word. So I will give 5 seconds for each item to you guys to guess the word. So number 1. So that is snail. Next. So that is disease. Next. So that is vector. Thank you. So what is schistosomiasis? Schistosomiasis is also known as bilharzia. It is a parasitic disease caused by blood flux or trematodes of the genus Schistosoma. After malaria and intestinal helminthiasis, schistosomiasis is the third most devastating tropical disease in the world. So, nag-occur lang mas common yung sakit na ito sa mga tropical countries. Kaya, sinabi dito na schistosomiasis is a major source of morbidity and mortality for developing countries in Africa, South America, the Caribbean, the Middle East, and Asia. So, ang causative agent ng sakit na ito ay 5. Ang most common na nag-cause ng human infection ay yung Schistosoma mansoni, Schistosoma hematobium, and Schistosoma japonicum. Ang less common naman na nag-cause ng infection ay yung Schistosoma mekongi at Schistosoma intercalactum. So, here is the picture of Schistosoma hematobium, the male and female adult. Next is the Schistosoma mansoni and the Schistosoma japonicum. So, what is the mode of transmission of this disease? Number 1 is bathing, yung pagliligo, swimming, washing clothes, and contaminated water. So, we can see na yung mode of transmission ng sakit na ito ay lagi sa water since we will tackle it later. So, the pathogenesis of this disease is the first, the egg excretion. So, infected humans, yung nag-carry ng schistosoma eggs, ay ilalabas yung worm na to through feces or urine. Depende kung ano yung species na nasa kanya. Kapag Schistosoma mansoni and Schistosoma japonicum, yun ay sa feces. Kapag Schistosoma hematobium ay sa urine. Next is the hatching and release of meracidia. So, ang meracidia ay yung first larval stage ng worm. So, upon contact with water, the eggs hatch and release meracidia, which are free-swimming larval forms. So, larva na siya. The third one is the snail infection. So, the meracidia penetrates specific species of freshwater snails, which is the intermediate host. So, yung worm ay pumunta na dun sa nails na mag-carry nung pathogen na yun. Next one is the asexual reproduction in snail. So, inside the snail, the meracidia develop through sporocyte generation, multiplying asexually, so nagdami siya dun. And then, Cercariae release. So, free-swimming Cercariae are released into the water from the snail. So, yung Cercariae na yun ay yun yung alabas ng snail from kasi nagkaroon na ng reproduction. And then, next is the human infection. So, Cercariae penetrate human skin upon water contact, marking the infective stage. So, yung Cercariae na produce ng snail, yun yung mapasok at mag-infect sa human. At dun nagkakaroon ng infective stage. And the next is the transformation into schistosomulae. So, after penetrating dun sa katawan ng tao, dun sa skin, yung Scariae lose their tails and become schistosomulae. So, next is the migration through circulation. So, schistosomulae enters the circulatory system and migrate through the bloodstream kasi andun sila sa dugo, so makalat sila sa buong katawan. So, next is the liver maturation. The schistosomiae reach the portal blood in the liver where they mature into adult worms. So, since yung dugo ay nadaan din sa liver, yun nga, yung portal blood ng liver ay papupunta dun yung schistosomiae, dun mag-mature sa liver yung adult worms. And then, adult worm pairing and egg laying. Mature male and female worms pair and migrate to specific venous locations depending on the species. So, kapag Schistosoma mansoni and Schistosoma japonicum, usually sila ay nasa mesenteric venules of bowel or rectum, na kaya yung Schistosoma na mansoni and japonicum, nabanggit ko kanina na sila ay nasa feces. Kaya ang nakalagay dito na eggs in stool. Tapos next is Schistosoma hematobium. Katulad kanina ay sa urine. Sila ay kadalasan nasa venous plexus of bladder. So, kaya yung eggs nila ay nasa urine. So, ito po yung pathogenesis ng Schistosoma species. Next, clinical manifestation. So, within 1 to 2 months, you may experience fever, chill, cough, and muscle aches. So, napaka-common ng mga signs and symptoms na hindi mo akalain na schistosoma na pala. So, inflammation or scarring occurs when eggs shed by the adult worm become stuck in the intestine, liver, or bladder. And then, chronic infections in children can cause anemia or lack of red blood cells, malnutrition, lack of nutrients, and learning difficulties. Next is the chronic or long-term. Schistosomiasis can develop if you do not get treatment. Symptoms includes abdominal or stomach pain, larger liver, since, di ba, sinabi ko kanina na dun sa liver, kapag na-reach na yung liver, ay dun sila nag-mature na adult worm. And blood in the stool or poop or urine, problems urinating, damage to the spleen, lungs, intestine, and bladder. Chronic infection can also cause increased risk of liver fibrosis or yung scarring of the liver, bladder fibrosis or scarring of the bladder, the bladder cancer or kidney damage. Kasi diba, siya ay nasa bloodstream. So, yan po yung cases na nagpapakita ng schistosomiasis. So, what is the laboratory diagnosis? Number 1 is the full blood count. And then the urine dipstick, microscopy, antigen test, and PCR. So, may treatment ba? So, meron po. Ang praziquantel remains the drug of choice for treating all species of schistosomes. Pero, ayon sa studies ito ay hindi man FDA approved sa USA. Pero, nasa USA lang yung gamot na ito, ang sabi ng CDC. So, sa typical dosage for Schistosoma hematobium, Schistosoma intercalatum, and Schistosoma mansoni ay 20 mg or per kilogram orally twice daily on day 1. And for Schistosoma japonicum and Schistosoma mekongii, 20 mg per kilogram orally 3 times daily on day 1. So next, the treatment. So for the species Schistosoma mansoni, hematobium, and intercalatum, ang drug ay praziquantel, the same as Schistosoma japonicum. So, kaya dalawa po kasi yung napagkunan ko na research ng CDC, kaya hindi ko sure kung yung dosage and duration ay alin yung tama. May nakalagay po kasi na 40 mg per kilogram per day, at yung isa naman ay 20 mg per kilogram orally twice gan. So, how do you prevent schistosomiasis? So, there is no vaccine available to prevent schistosomiasis. We should drink safe water, dry yourself well, and prepare your bath water. Now we will proceed to the assessment. What is the other term for schistosomiasis? So the answer is bilharzia. Next, what class does schistosoma belongs to? So it's Trematoda. Next, what species of schistosoma that causes most human infection? So the answer is Schistosoma mansoni, Hematobium, and Japonicum. Next, is there a vaccine for schistosomiasis? So none. There's no vaccine po. Last one is, what is the drug of choice for treating all species of schistosomes? So that is praziquantel. So that is all. Thank you.